would you like to do a small introduction about you?
Sure, absolutely. And thank you so much for having me, Francis. I am a complementary and alternative medical physician, and regenerative medicine and functional medicine are my forte. And I studied in US and Canada and also in Turkey for a little bit, and I continue my studies and my training, of course, and Europe, actually, in Czechoslovakia. I got some training also in stem cell therapies. So I do all kinds of alternative therapies using my nutritional science and biochemistry background, as well as a lot of other modalities that complement regenerative medicine and stem cell therapy. So everything from platelet lysate to other platelet type therapies, nutritional IVs and detoxification, and various other modalities that just complement the whole body in the best response and the best results.
Excellent. So you're talking about stem cells. What are stem cells?
Stem cells are a lower level cell that can regenerate and multiply and divide and become almost any cell in the body. So it can regenerate itself in order to reconstruct damaged tissue, or literally heal disease conditions. And that's why it's so And that's why it's so useful in regenerative medicine and undoing the damage and degeneration caused from aging and disease conditions and injury.
Interesting. So it begs into the next question. I mean, why stem cell therapy?
In today's world and with conventional medicine, it is so common to cover up the symptoms and to basically heal the symptoms without healing the underlying cause or of the disease or the symptoms. And finding the root cause and healing the root cause of a disease condition is what we're trying to do here with regenerative medicine. So instead of just covering up the symptoms with a medication or a painkiller or whatever it might be that is the symptom, we're actually healing the body at its core, stimulating the body to heal itself using your own body and using nature and the best of science and the best of nature in order to get to the root cause of the problem and actually heal the body, which will automatically take care of any symptoms that occur from that disease condition.
So basically, you're allowing your body to actually heal by itself instead of actually trying to get other forms of healers in a way.
Instead of using synthetic and pharmaceutical drugs, we're stimulating the body by using the body to heal itself. Mm-hmm.
Okay. Have you had any pushback from the big pharma in the sense of why you're using this?
I'm going to tell you my experience in the U.S. So I used to practice in Arizona for many years, and we found that the FDA, they have a lot of restrictions on stem cell therapy. So there is a form of stem cell therapy and stem cell treatment in the U.S. and Canada. However, because of the limitations put on by the FDA, which is the pushback from pharmaceutical and big pharma on the FDA, because it's big pharma that funds the FDA, and when there's no drug involved, when there's no drug involved, we're using stem cells from the patient's own body. We're using the patient's own blood to get growth factors and platelets. And then we're using vitamins, minerals, nutritional nutraceuticals and nutritional supplements to adjunct to the therapy, for instance, and oxygen therapy and things like that. There's nothing synthetic. So the pharmaceutical company is not involved in that picture. And so there's no money to be made because everything is coming from the patient's own body. And so that is the reason why FDA is so restrictive, I believe, because they don't allow anything. For instance, a patient needs to be treated within one session. In the US and Canada, the stem cells can't be grown, they can't be multiplied or differentiated, which means they can't be stimulated or activated. And they can't be combined with anything else. The stem cells, for instance, can't be combined with your own blood, for instance, the growth factors from your own blood, which literally can multiply the effectiveness of the therapy so many-fold, but it's not allowed. And so the limitations really are inhibiting results. And for the patient can't get the best possible results. And that's one of the reasons why I left the US to practice stem cell therapy outside of the US. And also we can just do so much more good without those certain limitations.
Okay, I see. So what types of conditions can be treated by stem cells?
Various different conditions. So anything from sports injuries to, if we talk about the musculoskeletal system, so sports injuries and degenerative arthritis, degenerative conditions, neurological conditions, autoimmune diseases like diabetes, multiple sclerosis, rheumatoid arthritis are big ones. Autism is another big one that we treat. Various different diseases, eye conditions, macular degeneration, optic nerve damage, various different diseases, almost anything that will respond to stem cells if done correctly.
Okay, so basically you're getting the stem cell from the patient. Where are you getting the stem cells from?
Very good question. Absolutely. Everything is, we call it autologous. Auto means cell, so it's coming from the patient's own body. In our case, we use adipose-derived stem cells, which are from the fat tissue, the patient's fat tissue. So we perform a mini liposuction procedure. Very non-invasive. It's very quick. It's done within an hour, and it's not even done with it's done with only a local anesthesia. So it's in the area that we remove the fat from, which is usually the love handle area. And most patients love that because almost everybody has excess fat in that area. Sometimes we go in the lower abdomen area or an inner thigh, but that's really rare. We usually get it from the love handle area on both sides.
So besides actually doing the treatment, you also do liposuction as well. So
that's right.
It's 2 for 1.
And in some very specific cases, we may use umbilical cord stem cells also, but I like to stick to the adipose-derived.
Oh, perfect. Great. So why Guatemala or Istanbul in Turkey?
That's a very good question. I alluded to that in one of the last questions in regards to the limitations on stem cell therapy in US and Canada. And so because of those limitations, and like I said, some of the major limitations are the fact that we can't combine the stem cells with other natural factors or antioxidants or growth factors from your blood, like I mentioned, which can make the stem cell therapy so much more effective. So that was one factor. And another factor is that we need to, by law in North America, the stem cells need to be taken out, isolated, and put back into the body within the same session, they say, within the same day. And sometimes that's not feasible because we may need to expand, which means we may need to multiply the stem cells to get a greater numbers, or we want to combine the stem cells, for instance, with other factors to enhance the therapy to make it more effective. And those things we cannot do in North America, in the US and Canada. And it's for that reason we do these therapies outside of Canada, like Guatemala and Istanbul.
Okay, and besides, I think that geolocation is very important as well, because someone from the US can be in Guatemala in 2.5 hours and be back after the session. So it makes it very convenient. Same thing with people from Europe going to Turkey. It also makes it convenient doing that as well. So if I have a condition and I come across your information, why should I choose to go with the STEM Health Institute? I'm sorry.
That's another really good question. What we do at the Stem Cell Healing Institute is we not only do a stem cell therapy and wish you luck and say, okay, thanks, Francis, thanks for coming. I hope the best for you. What we do is we have a very comprehensive regimen of a pre-treatment protocol, the treatment itself, and then post-treatment follow-up and protocol. And that in and of itself is alone at least 3 months. That doesn't mean, that's not to say that you're in Guatemala or Istanbul for 3 months. We only need you there for a couple of weeks. But we start the preparation of your body prior to the treatment, and then we continue it after the treatment. And we do that with various different modalities, like I said. So we use functional medicine. We use the best of nature and science combined to get the best possible results. Functional medicine means that we're using nutritional therapies, food, things like that in almost in a medical way to heal you. To get you prepared. And so we use food a certain way. We use certain nutritional supplements and nutraceuticals a certain way. We do a detoxification of the body when you come, which is not a rigid elimination diet where when you think of a detox, you think of a juice fast or things like that. No, we do a really intense nutritional cocktail, an IV cocktail, and the major